My name is Robert McMillen. I'm trained as a social psychologist, but most of my research is actually in the area of public health, with specifically looking at tobacco control. I'm interested in this topic because of the huge impact it has on our healthcare system, and it's the leading cause of death in the United States. Most of the research that we do in my lab is observational. That is, we conduct surveys of different populations, link the results and responses to contextual factors such as the price of cigarettes, whether or not there's a smoke-free local law, whether or not there's a ban on flavors in a local area, etc. And look to see what strategies predict less initiation among young adults and adolescents, what strategies help smokers or other tobacco users to quit, and what strategies actually help to prevent non-smokers or non-users from being exposed to cigarette smoke or to aerosol. Which is based on a collaboration with a very interdisciplinary, interinstitutional team. Most of the people I collaborate with are pediatricians at academic medical centers. I also work with a public health attorney, clinical psychologist, and myself, a social psychologist. And the research that we do looks a lot like what all professors typically do. It is the kind of research that you publish in peer-reviewed journals, write book chapters about, present at academic conferences, etc. But we also have a huge dissemination and translation component. One aspect is trying to change pediatric practices. Typically, when a smoker interacts with the healthcare system, it's their doctor or their dentist that advises them or counsels them to quit smoking. Quite often, pediatricians don't really see a parent as their patient, they see the kid as the patient. But what we're trying to do is to get the message out to pediatricians that if a kid comes in with an ear infection or an asthma exacerbation attack, that if the parent smokes, that is very likely the underlying cause of the kid's presentation at the clinic, and that perhaps the pediatrician could kind of break out of character and not just counsel and advise the patient, but also work with the parent to quit smoking, or at the very minimum, not smoke inside of the car or inside of the house. We also work through local departments of public health, lots of other venues to try to disseminate the messages of what we've learned about how to prevent tobacco use. And we do this at the local, state, and national level. So it's really been kind of interesting to get out of the ivory tower, if you will, and actually see the results of our research in action. So part of the assignment for this video was to give each of you a virtual tour of our laboratories. Well, as I mentioned earlier, most of the research that I do is observational. I really don't do much experimental work, at least in my own lab. I collaborate on a clinical trial looking at cessation. But within my own lab, basically we're doing observational research. And the surveys that we administer, we actually don't have our hands on the administration itself. Our school-based surveys are administered by teachers within each of the schools in our sample. We do a lot of telephone surveys done through the Survey Research Lab within the Social Science Research Center here at Mississippi State University, and we use Qualtrics for a lot of surveys as well when we have an email frame to sample from. So that said, we don't have what most of you would think of as a lab. Basically, we have office space in which to do this observational research. And as you can see in the background, I'll give you a little tour. There is what our lab space looks like. I hope that this brief introduction to my research laboratory has been interesting. And if you would like to learn more, I'm available. My contact information is at the end of this video. You can look at our website. You feel free to reach out via email. And welcome to Virtual Starkville in Mississippi State University.